Hi there, Chris.
Good day, sir. How are you?
I'm great, thanks. Yourself?
I'm doing very well, thank you. Just came back from a nice, long, brisk walk with the dog through the neighborhood, so I'm feeling good right now.
Great stuff, lovely. It's good morning to you, I believe, with it's good evening where I am. So welcome to the podcast, Chris, and thank you so much for taking the time to do this.
Absolutely.
Great stuff. I wonder if we could maybe start with just a little bit more background on yourself, if you don't mind. You know, maybe your journey to how you got into behaviour. And also you have that little awesome dog in your profile picture. Is that an English Bull Terrier, Chris?
He's about 75% English Bull, yes. And then another quarter Basenji or a miscellaneous terrier, depending on the genetic test that you look at.
Wow.
So, yeah, he's a piece of work. He's not, full transparency, he's not the type of dog that I would typically gravitate toward.
Okay.
He's got a huge personality, which is great. I generally gravitate a little bit more towards, yes, lower energy, but also perhaps a little bit more, shall we say, biddable, and perhaps a little bit more influenceable than what I know the Bull Terrier breed to be. So he's taught me a few things along the way, and he's a striking dog for photos as well. So I run with that.
Yeah, he's gorgeous. He's gorgeous. And we were just about to touch on there on your kind of journey of how you got to where you are just now, Chris. If you wouldn't mind just taking us through that, I'd really appreciate it.
Absolutely. So I've been doing what I do now as a veterinarian and someone who is either board certified or someone who has really done exclusively the work within that veterinary behavior space. Gosh, since 2004. So about 17 years now, I've been sort of in this particular space. Prior to that, I was a general practice veterinarian. In fact, when I graduated from veterinary school, I had zero intention of specialty. I had a little bit of interest in behavior just from wouldn't that be fun to incorporate that in what I do on a daily basis in the practice? But didn't really, well, truthfully, I had zero interest in going on for additional education. I was like, I'm done. I'm ready to earn a living. I'm ready to have clients. I'm ready to be my professional self. And I was about a year and a half in. I started doing a little bit of additional continuing education in the behavior space. And number one, fell in love. Number two, realized that I had a decent level of skill. And number three, really actually made that shift for the clients themselves, more so than for the animals or for really trying to address the animal side of things. And that was actually a realization that just came to me in the last probably 3 to 4 years, was sort of the motivating factors that actually had me go into behavior as a discipline, even though I got into veterinary medicine for the animals and sort of that healing, wanting to help. But the shift over to behavior was just as much for the people. So the two-legged animals, so to speak. And so that's been a big part of the journey. In the time that I've been working as a vet behaviorist, I've owned multiple practices, both in the Minneapolis-St. Paul area of Minnesota, so in the central US, and then now out in Portland, Oregon, operating both house call exclusive practices, and then now functioning more as a within hospital practice. And now, of course, doing a whole lot of telemedicine as well. So it's given me a nice, well-rounded experience in the discipline.
Awesome. And you're cross-species, Chris? Any specialism, or do you work right across all species?
So I will consult across all species, especially where that intersection between sort of medical concerns and behavior exists. I'm happy to consult. I only treat dogs and cats primarily within the practice. The reason for that for me is that I've kept up on their unique medical needs, which allows me then to really dive into that consultant and veterinary role versus, let's say, equines or avian species. I will consult with veterinarians, but the rule is they have to know the medical side, and then I can figure out where the behavioral side intersects with that. But I don't feel quite confident enough in my own skills now to really feel like I would be able to really flesh out all of those areas that might be relevant for those cases.
Gotcha. And I guess I would like to start by maybe defining your role as a veterinary behaviorist and what sort of process you went through to become one. You started off as a vet and then became a behaviorist and married the two and became a veterinary behaviorist. Is that fair?
Yeah, that is fair. Yeah. So the veterinary behaviorist journey requires the veterinary degree first and foremost, which sort of gives us a bit of a different toolbox or a different skill set when it comes to how we assess cases, looking through them more through sort of the medical model or the medical lens. Not to say that that's better or worse than other models like ABA or any of the other approaches, only to say that they're not the same. And that's actually one of the things that I love, is being able to say, cool, this is how I look at this case. What do you see? What is your lens? And again, sort of where can we sort of create more of a three-dimensional image of exactly what may be going on here? And then what does that open the door to in terms of intervention opportunities? So that's part of it. But the veterinary behavior education, if you will, includes residency training that varies anywhere from 3 to 6 years, depending on the type of program that one goes through. It's heavily mentored, as well as requiring the individual to publish primary research, write a couple of case reports that demonstrate your skill level, not only in treating cases, but also describing and sharing that information in a scientific way, and completing a pretty significant amount of graduate level coursework, roughly equivalent of about a master's degree. Again, without the thesis, it's not a master's, but in terms of the amount of coursework that's required, it's reasonably comparable, at least with the programs that I've looked at. And then you sit an exam at the end, and that's the process of board certification.
Wow. And quite a long process to go through, I would imagine. And how does that then differ? I guess that you touched on that briefly about the role of kind of behaviour consultants and trainers. Where does the veterinary behaviour role sit within that kind of structure, if you like?
Yeah, it varies a little bit based on who you ask. So I'll give you my perspective on that, because, well, that's my perspective, and I'm the one talking with you today, so that's the one we get. I love the roles of the trainers and the behavior consultants, and especially their level of expertise in understanding the science of behavior change and really working with clients and collaborating in those ways. The unique piece that we're able to bring to the table from the veterinary behavior perspective is ideally, yes, those skill sets that I just mentioned in terms of science of behavior change and understanding all the different principles, and also a thorough, comprehensive understanding of the medical issues. So if we're looking at how does pain manifest, what does the neurobiology, what does that influence look like, whether we're talking primary neurologic conditions like seizure disorders and other things like that, whether we're talking endocrine or hormonal issues, how might that show up? What are some of those developmental stages? Again, thinking physically, physiologically, how does that show up? And especially when we're talking about things like pharmacological support for behavioral issues, what does that look like within the individual? What are the indications, the contraindications, the interactions, the polypharmacy sorts of things? We're able to look at all of those things and pull in the individual elements of those skill sets based on what the case in front of us requires.
Sure. And maybe we could talk about some of the criteria that a behaviour consultant might meet for a referral to a veterinary behaviourist, Chris, if you don't mind.
Yeah, absolutely. And quite honestly, and this varies a little bit based on the practice. There are some individuals who really do work more on a referral basis. And this does actually change based on country as well, based on the way in which veterinary medicine functions. That's been my experience when I've done some cross-ocean consulting across over to the UK as well, is that I understand the process is a bit different based on where we are in the world. In the US, at least, most of my colleagues are open to taking even just primary self-referred cases. I'm a pet owner, I've got an issue, I want to go to the vet behaviorist, here we go. But we do work a lot collaboratively with trainers, behavior consultants, and then other veterinary team members, knowing that, at least within my practice, if it's a patient that requires extensive diagnostic testing, especially including things like MRI or CT scans or advanced diagnostics, I'm going to be working with other veterinarians or specialists to perform those. And if it's a patient that will benefit from extensive coaching of the owner or even direct education of the animal itself, I'm going to be working with trainers or behavior consultants rather than me being the one to to be guiding the client through each and every one of those sessions. So I really think that our specialty is one that thrives on collaboration and really exaggerating each of those individual roles and say, cool, here's what I bring. What do you bring, and what can we do together that's greater than the sum of our parts?
Yeah, it's so exciting, that collaboration too, when you're working with different professionals. So you work with trainers, behaviour consultants, veterinarians themselves directly?
Absolutely.
Yeah.
Yes, absolutely. And we do a lot of collaboration there. We try to make sure that that they're at least aware of what it is we're doing on the behavioral side, knowing that not every veterinarian has a strong interest in behavior. Many of them are more than happy to say, no, I referred it to you. You go with it. Yeah, just, you take care of it. Let me know if you need me. But then we do have a lot of our veterinarians, especially those who perhaps operate or work in an area that's somewhat underserved by the veterinary behavior community just based on location. And so in those cases, then rather than me seeing that client and that animal myself, we do more of a vet to vet collaboration service to really say, hey, not just what can we do for this animal, but can I give you 2 or 3 more nuggets that are going to help the rest of the animals in your practice as well? And how do we do that together?
Sure. And it's such a long journey for a veterinarian anyway. To bolt on behaviour on top of that could be, I guess, beyond the realms of what would be achievable in that role. And I guess to supplement it with that behaviour would be fantastic. And I guess that's where the veterinary behaviourist comes into it, isn't it? You've got the veterinary skills, but also you have the behaviour knowledge to supplement that.
Exactly. And sometimes I think about my role, especially in those cases, yes, as a diagnostician, yes, as a clinician, but in some cases almost as a translator, where I'm able to say, hey, when a client says this is often what they mean. Let's ask 2 or 3 more questions to really make sure that we're on the right track there before we make assumptions. Or if I'm talking with the veterinarian and they've got perhaps a training report in front of them, and we've got a trainer or a consultant who says, oh, we're doing, this particular method, and we're utilizing this method of desensitization, counter conditioning, and we've advanced thresholds in these 3 parameters. And I get my veterinarian who's like, yeah, I don't have a clue what any of this means, and vice versa. If I'm trying to help the consultant understand either what sort of feedback they can provide to the veterinary team, or how some of the veterinary inputs may really influence the way we approach a particular case, especially when we're dealing with physical issues, again, like pain or physical ailments of some case. So that translator role is a whole lot of fun for me. It's
a great way of putting it, too, for sure. And what's the referral process like then? Can that come really from any direction, from vets, from behaviour consultants, from trainers? I guess that will keep you busy. You mentioned the pain component to behaviour cases, and it's something I wanted to talk to you about in the prevalence of underlying medical issues in behaviour cases. Can you give a rough estimate? There is a comparison in the UK where we thought about 70% of noise phobia cases had an underlying medical condition potentially driving it. Could you give a percentage on that, or is that too vague, do you think?
I think it's a really challenging one to nail down. I think we can look at some of the, let's look at these 100 dogs who have presented with noise phobia. And then we can look at their individual cases and we can say of these 100, 70 or 40 or 52 had these particular components. Where I think it gets really tricky is based on how you ask the question. You can get very different answers based on the individual's level of awareness. By individual, I either mean the pet owner if they're answering a survey, or the primary care veterinarian if they're the one who's providing some of the input. We don't always get what I would consider to be 100% accurate information. So it's tricky. I think in some cases we're overrepresenting. In other cases, I think we're perhaps underrepresenting. And in others, we say these are probably 2 completely independent conditions, where this is an animal who has a primary noise phobia, potentially because of emotional trauma or insufficient socialization or any one of those inputs, and it's an animal who has pain. How do we really say, is this a correlation? Is there any degree of direct impact, or are they completely and totally separate from one another? That really requires, in my opinion at least, a much more involved investigative approach to say, well, okay, let's understand the behavioral pattern, let's treat pain, let's see how the behavior changes, and vice versa. And that's when we can get a better sense of whether we think that the pain is in fact manifesting as behavior or contributing to, or again, completely and totally separate. And we see cases of all of those variations when they come through the practice.
Sure. And I wonder if we could maybe go through the importance of ruling potential underlying medical issues out in behaviour cases. And it's so easy to miss something that could be a massive contributor, as you say, and I wonder, is that something you would recommend for every behaviour case for a behaviour consultant, particularly if you're taking on a more complex case?
And again, it's tricky. You know, the famous answer, of course, it depends. Sure. You know, we hear this over and over and over again, and it almost feels a little tongue in cheek to say it now, but it does depend, because there are many of the cases that come through that are complex, that are showing a significantly complicated behavioral manifestation, and it's entirely possible that it's completely due to behavioral causes. So I don't necessarily assume that because a case is severe or complex, therefore it's going to be, happening due to a medical issue. And yet also some of the more simple cases, a dog who's a little bit head shy, might be because of neck pain or ear issues or dental pain. So for me, it's in the best possible case, yes, we would say there is a behavioral change. There's an animal who's displaying a behavior that is perhaps unsafe or undesired. At the very least, yes, let's get a comprehensive physical exam to see whether or not anything shows up there. Knowing that, depending on that veterinary practitioner's level of understanding, they might miss some things. And I don't say that in any sort of a judgment or a slant or a criticism. Unless you really, as I said before, sort of understand that intersection, you may not know that, these particular combinations of behavior patterns are really suggestive of ocular or eye pain. Why would you know that unless you know that? So you wouldn't be looking at that in quite that same way. Or these are indications of a particular triglyceride level disorder that may show up as aberrant behavior without a pattern. Like, why would you know that unless you know that? And those are things you're going to miss on a routine physical exam. So I do think that it gets complicated to really rule all of that out as much as we would like to.
So practically impossible in some respects to rule out all medical issues or contributions to that behavior.
Yeah, it is. And that's why I love the collaboration piece, and sometimes we'll do, a physical exam and say, I don't see any reason for this animal to be showing a particular behavior pattern, at least not today. Let's see how this animal responds to whatever interventions feel appropriate, and let's leave that back door open again. So on the off chance, if we see something else that changes our picture, we've left an opportunity there for investigating a bit further.
Yeah, sure. And one element that we wanted to talk about today was about the client side of communication in behaviour cases. And I think it's something you have a very well-developed set of skills. And if that's fair to say, Chris, was that something that came naturally to you, or did you have to develop that over time?
It's definitely been something I've developed. I would like to say that, how should I put this? I enjoy it. I'm passionate about the client experience and about the communication. So I think I probably perhaps lean into that side of practice a bit more than some of my colleagues do. And it's allowed me to see some potential opportunities for advancing my skill set there that exist. I'm grateful to say that I had a lot of exposure early in my career to the veterinary social work profession, which really expanded my lens to say not only what's going on physically, not only what's going on within the quadrants of behavior change, if we restrict ourselves to the quadrants, but also what's going on in the rest of that family unit, and how might that influence what's going on, whether we're talking about environmental influences, whether we're talking about social or emotional factors, and at the same time recognizing where those influences exist, but also recognizing that as a veterinary behaviorist, that's actually not my training. That's not my job to dive in there and take on the weight of some of those other factors, but rather, can we identify it? Can we name it? Can we either figure out a way through or around and sort of still accomplish what it is that we're looking to accomplish?
Sure. And do you feel that weight of expectation sometimes in cases? I certainly do personally. Kim Brophy really helped me get over some of that with her really lovely insights, but not taking that too much onto ourselves in terms of solving every problem that's out there, because it's just not possible to do. Is that fair to say?
It is fair to say, and especially some of my early cases, really up until recent years, as I've developed a bit more of a skill set in that particular area as well, I've carried the weight of some of those cases for more than a decade. Wow. That's not healthy. That's not healthy. That's not benefiting the pet. It's not benefiting the next pet. It's if anything, is becoming a bit of a distraction or a distractor from really putting my efforts into new cases. And yet there's also something to learn from those cases as well. So I'm not saying we just sort of wash our hands and move on and go next. This is not an assembly line. This is something where there is value that comes from each of those cases, but also in acknowledging what I can control is my effort and my intent. I can't always control how that lands. I can be accountable for it, but I can't control it. And I certainly cannot control what happens for that animal, for that client, for that household the moment I've stepped away. And so I've really had to lean into what is within my control. And even there, sort of maybe pulling back and saying what's within my influence.
Sure.
And really just acknowledging the things that exist beyond that. I have to then really occupy my role to say, I'm going to understand a case to the best of my ability in the time and the space and the resources that I have. I'll present options and hopefully allow that client to make the decisions that are right for them. And as they need additional support or feedback, then I'm available for that as well. But I can't be the force that pushes. I can't be the force that pulls. I can't work harder, care more, do more than my client does. I have to basically be there. In some cases, I compare myself as the GPS, right? It's not my hands on the steering wheel. It's not my foot on the accelerator. I'm not even the one who decided if we got in the car. But I can help you understand what the route looks like. I can help us to recalculate when needed. I can give us sort of a reasonable prediction of where I think we're going to land and when, but I can also not take it personally, like the GPS that is a bit more mechanical there. There's no value attached to one destination or another, or even for the route for that matter. I'm really there to reflect and provide additional feedback where I can.
Sure. And each client we work with, both dog and human, are completely different. So we need to, I guess, adapt our communication style accordingly. And do you have any advice in dealing with clients in that regard, especially the ones that are maybe more resistant to change? And how do you go about setting those expectations with kind of people with that resistance?
Yeah, I think for me, it's sort of trying to figure out as best I can, as quickly as I can, where are they starting from? Is this a client who is there because of family pressure? And, they're there because someone else has sort of coerced them into seeking help. Maybe a family member was bitten by an animal or something along those lines. And they're really not that motivated to do anything at all. Me stepping in and trying to create a lot of solutions really probably isn't going to land particularly well. And I'm actually going to potentially burn myself out in the process. So I need to identify that from the get-go and just ask some questions. If I had solutions that would help you to improve safety, improve relationships, decrease stress, decrease, risk factors, is that something you're interested in learning more about? Because if the answer there is no, I don't really have a lot I can do, right? We have to do this as a collaboration at some level. Now, if the client says, nah, that's not really interested in me, but can you tell me how to get my family off my back? Yeah, I can probably help you with that. Like, that's a different focus of behavior change, but let's have that conversation. And who knows, maybe I'm going to be able to weave some thoughts in there that opens that client up to the possibility that, actually some relatively simple management changes won't require a lot of effort from me, but they may have a dramatic impact on the way in which, this all sort of shows up at the next family gathering, for example. Cool. If that's all we accomplish today, but you're happy, I'm happy. So it's identifying where they are, what do they want to accomplish, and asking hopefully some good questions that allow us to really tease out where we're headed.
Yeah. And I guess that non-compliance can be a major factor in the outcome of a case. And I wonder, do you have lack of compliance can be born from various different origin points, right? We are dealing with people who are maybe under stress, duress, distress themselves. And I wonder if you've got any examples of gaining compliance or any tips in terms of getting them on board when they are in themselves under a lot of stress with their dog or animal.
Yeah, I think the first part for me is really to ask questions and not be afraid of asking difficult questions. Mm-hmm. For example, if I'm seeing a case and perhaps I'm in the second or the third revisit and I just don't feel like we're getting any traction, there's an ongoing feeling like, hey, I'm giving you what I think is really good advice, but for whatever reason, nothing's moving. So now in my career, I'll call that out, not as a place of judgment or criticism, but to say, from my perspective, this conversation today actually feels pretty similar to the one we had before. I like to know or be able to demonstrate the areas where we're moving forward from one session to the next. I don't have the perception that that's happening. Does that fit with your perception as well? And usually by the time I'm noticing it, the client's already frustrated as well. So then we're kind of looking at the problem kind of shoulder to shoulder. Yeah. What's going on over here? We're not moving forward. What can we do? Do you have any thoughts of anything that may be holding back progress? Is it an understanding of expectations? Is it needing some additional support for the actual hands-on mechanics? Right now, are you strapped with work and life and quarantine and it's just too much? Okay, then let's redefine our expectations. Let's figure out what do we want to accomplish going forward. And so I think for me, the place where I've really grown in that area is, again, not shying away from the question, but also trying to find a soft way in where I can learn more about where the client is coming from, as opposed to assuming or presuming that I understand that they just aren't doing the work, they're lazy, they're, obstructive in some way. I actually don't know. I probably know a tiny, tiny, tiny slice of what's going on in their world. So by being curious about that, I may get the opportunity then to influence the outcome in a different way.
Sure. And I guess when we're setting those expectations, it is difficult for these people, isn't it? They are working with, potentially a lot of barriers to success in terms of moving forward with their dog or animal. And I wonder maybe if we could talk a little bit about some of the kind of labels that are used and how we can maneuver around them. I've saw some great seminars with yourself before, Chris, where you deal with this really well. And I think it'd be really beneficial to anyone listening about unpacking some of the labels, which could be useful in some respects. Maybe if I give you some examples, we can talk through that and how you work around it. And we may hear people talking about terms like dominant or territorial or stubborn and disobedient. And whilst, we could be, direct about challenging those preconceived ideas, it does give us insight into how they interpret the world, the lens of how they view the world. Is that fair to say, Chris?
I think it's a really fair way to say that, Jimmy. I think that there's especially when you talk about a word like dominant, for example, that carries so many versions even of what that looks like. And so rather than, as I know that I did earlier in my career, if someone says, well, I think she's reacting this way because she's a dominant dog, it's like, okay, hold on, let me get my soapbox here. Okay, no, your dog is not dominant. It's this, and I go into my entire ethology lecture and the client's like, whoa, I don't know what just happened here, but clearly I struck a nerve. And then I'd have to look back and go, oh yeah, no, that probably wasn't the most effective way to create behavior change there. Sure. Whereas now, if a client says, oh no, I think that this is happening because she's a dominant dog. Tell me more. What does that mean? A lot of different thoughts come into my mind when I hear that word dominant. What's your definition? What aspects of her behavior fit underneath that umbrella? And it allows me the opportunity to find out, is this a client who's utilizing that word because that's what someone at the dog park told them and they don't really even have an emotional attachment to it? They just actually thought they were using the right lingo and they're more than happy to change, versus someone who perhaps has, a multi-decade history of really leaning into pack dynamics and alpha hierarchies and all of that, in which case then I have to have a conversation at some point to say that my viewpoint's going to be a little bit different than that. Can I share with you the lens that I'm looking through? And then let's find out if there are some similarities that are going to work for both of us, or are there some things that we're going to need to shift? And so again, in either case, I'm really, rather than sort of meeting someone head on, it's more of, can I invite you in? I've got some stuff. I know some stuff. I've been doing this for a long time as a professional, and there's a lot of stuff I don't know. Most importantly, I don't know what you're thinking. So tell me about that. And then I'm going to ask you if I can share some information back. Is today a good time to unpack what dominance is or isn't? Or should we leave that for another day? I'm happy to go either way. What works for you? But really thinking about that label as, rather than making an assumption, or assuming, oh my gosh, they're calling their dog, stubborn or stupid or, whatever that is, rather than now painting sort of a picture or a caricature of that client and what they're looking at, I'm just going to ask a follow-up question. What does that look like? Can you give me 2 examples of when stubborn shows up? Because, I know from the work that I do in practice, the vast majority of the dogs who have ended up with a label of stubborn are either, and this is really oversimplifying it, but either have never been given the benefit of actual clarity of education. So they're clueless. They just don't know what's expected of them. So they look stubborn because they're confused. Or we've got some influence of fear, anxiety, stress, emotional arousal, something that's acting as a barrier that's preventing that animal from being perhaps as flexible or as able to opt in for that training experience as we'd like. In either case, neither of those are really about being stubborn. And once we understand that, then we can come at it from a completely different angle. And I don't even really have to sort of get that client to let go of the stubborn word. I can just give them a new version of what's going on and ask them if that resonates.
Sure. And it's an interesting one because I think that it varies per consultant or per behaviorist, where some people will meet it head on, some people are happy just to park it entirely and just not deal with it later once we've demonstrated or we've shown a better way of how to engage with the animal. But it does give us insight, doesn't it? And I think that tendency for kind of human abstraction, kind of like just labeling things, but it really is problematic, isn't it? Because when we label a behavior, we don't necessarily look at the observable behavior. We look at the lens of how we see that behavior through our own prism. Is that a fair way of saying it, Chris?
Absolutely. And as you say, the insight that we can gain from asking some of those questions may give us a little bit more perspective even on how some of the other aspects of our treatment or our training plan may show up later. If it is that client, for example, who's really invested in hierarchy, and that's really important for them, well, I might, let's say I'm working with a dog who has more of a generalized anxiety tendency, and I find that for many of those animals, creating really consistent communication through cue, response, reward sequences can create a lot of structure and predictability. So I feel very strongly about that for some of my patients. On the other hand, if this is a client who's leaning into pack dynamics and I'm talking about cue, response, rewards, they may hear that in a completely different angle. And their brain goes into nothing in life is free, or, I need to coerce the outcome because I am ultimately in control as the alpha. None of which is what I said, but those are things that kind of run in parallel tracks. And so if I've got a mindset of where that client may be seeing this particular issue, it may allow me to even say, this is going to sound really similar to something you may have run into before. Can I paint a picture of how it looks just a little bit different? In fact, it's actually cool. You're already familiar. The groundwork is there, but there's 2 or 3 really important but subtle differences that will make or break whether or not we're successful. Can we have that conversation today and then see where that takes us?
Sure. Makes sense. And I wonder if we could talk a little bit about boundary setting. And this is something I think I've seen before in the past with yourself, Chris, which was wonderful in terms of the way you articulated boundary setting, which can be challenging when we work with people. Let's be honest, it can be difficult where maybe people overstretch or maybe lean too much into the behavior consultant or clinical behaviorist, veterinary behaviorist. And we, I guess, need to be careful we don't encroach into the human counselling side too much, particularly if we're not qualified to do so. And how do you avoid that? Do you have any strategies or tips that you could share with us, Chris?
Yeah, I think there's a boundary here that comes at it from a couple different angles. One is, whenever I'm working with a client or an animal, I try to be really comfortable as best I can. Sort of what do I feel I can say about this case, whether it's the client, whether it's the animal, whether it's the condition, what do I feel really comfortable and confident saying based on what I know and what's within my particular credentials. And the moment I kind of start to get to the fringes of that, I start to slow things down. My wording changes a little bit, from this is this, or this appears to be this. It becomes more of a, this may be consistent with this, or I wonder whether this is a factor. And we start to get a little bit more curious about it, because the further away we are from my core knowledge, the more wiggly I have to be about sort of where those lines are drawn. And I have to be really honest with myself, where a client may come to me looking for answers. And I don't know is just as good an answer as anything else. And if I'm able to say, that's a really good question, I don't know the answer, but I've got some people who do. I can check in with my neurologist colleague. I can check in with my social worker colleague. I can check in with someone else to figure that out, or I can make a lateral referral. I'm actually not the best one to act as a translator here. You should call Susie or whoever the individual is. Let me connect you with her or with him or with them. And we're able to make those connections there. And it allows me to be sort of within integrity of what I can do, not feeling like I'm overstretching myself to fill their need if that's not something that really exists within my role. And so that is one place for me where boundaries become really, really relevant. And I think the other piece that for me is when I'm working really perhaps more on the client side is that if I feel like my boundaries are being encroached, for example, if I've got a client who's calling me in the middle of the night or is texting me 4 times a day or, is expecting responses and, via email on the weekend or, needs to be able to get in for an emergency recheck, in less than 48 hours notice, no exceptions. Those are things that I can take very personally because those are often things that I can't do. And whereas before I may have taken that a bit more offensively, who do they think they are that they can just jump into my world and, make me do these things? Or perhaps I might even thrown those boundaries up in more of a defensive manner that perhaps wasn't as tactfully communicated. I try now to ask more of the question, if, wait a minute, this is a client who's emailing on the weekend. Okay, is this a client where it was a priority for them? And so they wanted to get it off their plate and they actually have no expectation of a reply, but now I was the one checking my email on the weekend. So it was my own boundary that I sort of violated in that. Or if they truly do have the expectation they're going to hear back, then I have to ask a second question. Did I set the expectation that that's not how this works? Because if I've been, I almost used the word guilty, if I have displayed the behavior pattern of responding at all hours of the day, 7 days a week, I've actually set the expectation for the client that I am available 24/7. And then that's on me to redefine or reclarify that boundary in an educational way. Hey, I got your message. I happened to pop in. I'm more than happy to answer that. In the future, I'm really focusing on responding to emails Monday through Friday from 8 to 5 p.m. If there's something that falls outside of that, just know I'm not likely to see it. I hope that lands well for you. Cool. Something that just sort of reestablishes that boundary versus me stewing on it, carrying the emotional weight or any of those other things that can really start to wear us down.
Yeah, that's so helpful. And it's something that I've suffered from before in the past of sitting at 10 o'clock at night and going through emails and seeing something that at that point you have no control over and then worrying all night and not having a great night's sleep. So it's really valuable information. Something I need to do more of, which is setting those expectations early on that you're not 24 hours a day and we shouldn't be either from a compassion fatigue, emotional fatigue point of view. And I guess that's something that dovetails lovely into one of the questions I want to ask you about. That is, that will definitely one of your strategies, I would imagine, Chris, in terms of avoiding compassion fatigue and burnout and that type of thing. Do you have any other tips in terms of those types of areas in terms of managing stress, that type of thing?
I do, and I think this is a place where individuals who are within the behavior change professions have a bit of a leg up here in terms of a skill set that already exists. And what I mean by that is, when we're talking about creating a behavior change plan for, let's say, a dog with aggression that appears to be based in fear, right? So we're working with that animal. I'm not going to go into the mechanics of what we do there, but just conceptually, we're trying to create that threshold, right? We're going to teach skills while that animal is completely calm and relaxed. We're going to try to keep them out of situations where they're over threshold and operating from a place of defensiveness or panic. And yet, if all we do is oscillate between those two extremes, we didn't actually develop a more effective skill set. What we have to be able to do with that animal is sort of feather that edge, help that animal to perceive, let's say it's a dog who is showing a fear response to small children. If I'm doing all of the work in isolation of kids, the dog will never get better. If I turn the dog loose in a playground, bad things are going to happen. But if I can get that dog just close enough or just aware enough that the animal goes, oh, I'm going to need to figure out what I do next. And then they develop a more effective coping strategy with some help, whether that's operant or classical or, combination of both, whatever it is that we're doing, then we move our threshold. I say that because we do that all the time, right? We're going through that, whether we're doing performance sports, whether we're doing emotional therapy, we do that all the time as we're advancing skill sets. The same thing applies here too, that if I'm saying, oh, I'm going to go on vacation, I'm going to go, invest in self-care for a week. Cool. That's a great way to recharge and recover. But if I just throw myself back into the trenches and I didn't actually develop a skill set that improved my ability to navigate lower and then progressively higher levels of stress or burnout or emotional fatigue, guess what? I'm oscillating between the extremes, and it doesn't take many repetitions of that oscillation before I say, you know what? Pardon the French, F that, I'm out. I can't do this because I literally can't do that. I've not actually developed a skill set that allows me to do this. So being mindful about what would that look like to actually develop coping strategies. And it's something that I'm reminded of on the human side of therapy. Therapists, for example, are required, as I understand it, to have a therapist of their own to offload the stress that they actually internalize by helping others. We don't do that. No. We need to. Yeah. It would be super beneficial for us to be able to do that, but we don't. And so many of us, I believe, are taking on weight for things that we would love to be able to help or fix or improve, but without the affecting coping strategies to actually offload that stress ourselves. So for me, when it comes to this, yes, client communication is valuable. Yes, understanding our skill set and setting boundaries. All of these things are super important. And what are we doing? How are we actually processing that in a meaningful way, knowing that my way is probably not your way is not my way, but what can you do and what can I do to stay in the game?
Yeah, and it is a real thing in our industry, isn't it? It's very prevalent within veterinary, behaviour, any care sector really, where you are having to care on a regular basis, and that burnout can happen fast and catch up with you quick. And that's some really great information. I think boundary setting would definitely be something I need to develop in my career and put just a little bit more boundaries in terms of, when I'm working and how often I'm working and that type of thing, which, yeah, for sure. And I wonder then if we could have a conversation about, maybe some clients that are in a similar sort of burnout potentially with their animal, dog, whatever, and it maybe came to the point where the outcomes are pretty limited and sparse. They're maybe facing trying to rehome their dog that's maybe, bitten somebody, for example, and rescue won't touch them, and they're at that point where they're considering potentially behavioural euthanasia for their case. And I wonder if you could talk around about that, because I find that a really difficult conversation myself to have. Do you have any advice there, Chris? Bill?
I do. Yeah, this is a conversation. I was just grateful to be able to host a conversation with quite a few people in Mike Shikashio's platform within the Aggression in Dogs platform, and around this topic of behavioral euthanasia and how do we navigate that and what does that look like. And so it's something that I'm passionate about, because it is something that comes up within our work, whether we want it to or not. It comes up, and I think for me the honest answer is that I try to check in with my clients and just find out what do they have available. What are their resources, whether that be financial, whether that be emotional, whether it be, logistical, household, family resources. What do we have available to us? And acknowledging the fact that, not everything has a rosy outcome. It's not only just like when we were talking about, I could only control or really sort of invest in my intent, not necessarily controlling the outcomes. The clients are navigating the exact same thing. The client who may have the perception, but I've spent all this money, or I've spent all this time, or I've put all of this emotional investment into fixing this. Why isn't it better? And I have to, really have that conversation to say, well, this is a living, breathing creature, and we can influence, but we can't necessarily control in the way we would like to. Do you have additional resources available? And I say that hopefully not coming from a place of judgment of, well, you're going to have to do more if you want this to be better, but more from the standpoint of saying, if you're at a point where It's as good as it's going to get with the resources that you have at your available disposal. And if that's not good enough, then we may have to consider alternative outcomes. And I say that not from a place of judgment, not from a place of criticism. I'm not trying to coerce any sort of outcomes, only to say if where we are is not safe, is not good enough from a quality of life standpoint for the animal or for perhaps for their family, that's not a place that we get to stay, right? What do we do next? What is our active decision about where or how we're moving forward? And that again becomes my opportunity to let the client know, at least to the best of my ability, what outcomes exist. And, as I say within that particular webinar is, when we're in that sticky spot, every outcome has its own challenges. There isn't going to be a way in most cases to sort of uncover this magical solution that all of a sudden, feels comfortable and easy and fast and effective. That really doesn't exist in those complicated cases. And so for me, I will have the conversation with my clients to say, here's the pros and cons of this option. Here's the pros and cons of this one. This one's hard for these reasons. This one's hard for these reasons. Choose your hard. What works for you? Sure.
Do you find behavioural euthanasia would be for the owner to decide ultimately? You can only make a recommendation, or is that the case from your side?
It is, an owner in most cases is sort of the owner caregiver. In some cases that might be the rescue, or whoever sort of is the owner or caregiver of that animal is ultimately charged with making those decisions. I honestly cannot think of any cases where I've told the owner outright, you must do this. It's not my decision. Animals are property, regardless of how I feel about that, which is a whole separate conversation.
Yeah.
The fact of the matter is, that is the case. That is their property, and I can give them the options and I can give them the pros and cons. But me putting my viewpoint into their situation, I find is inappropriately levering a power dynamic that actually changes the way in which clients make their decisions and how they navigate the fallout of what that coercion may have looked like. And so for me, as much as I understand that the clients sometimes come to us asking difficult questions and just sort of hoping that we give them a clear answer, what they're ultimately looking for in most cases is clarity, not the answer.
Yeah.
And I can give them clarity to the best of my ability. But the honest answer when they ask those questions, well, what would you do or how would you go forward? The honest answer is I don't know. I don't have the same relationship or household or spouse or budget or any of those details. And so it would be inappropriate for me to insert myself into their decision-making process. The only exceptions to that, and I always have to put this little caveat in there, if there is a vulnerable population at risk, if we're talking about kids in the home or public safety that's being endangered by the way in which an animal is being managed, or perhaps there's an elderly or a cognitively impaired population that is going to be affected, then there may be times where we have to get an advocacy group involved. But even still, I'm not telling them what to do. I'm saying this is the way in which this particular animal must be managed in order to maintain safety. If you choose to do that in such a way that's not maintaining the safety of these populations, then advocacy groups may need to get involved. But it's, I'm not dangling that as a threat. I'm not saying, again, that, I'm here to euthanize your animal. To answer your question, no, I don't believe that that's my or our collective responsibility within those cases.
Yeah, I agree, and that's so valuable. I'm actually dealing with a really tricky case at the moment where that may be the outcome, and that's just so valuable to hear from me personally. So thank you for that, Chris. Do you ever find people who are coming to you for that outcome, though? Have you ever had that?
Absolutely.
Yeah.
And so, but I hear that. I hear you don't really know, but what would you do? And I double down. I basically say no. I really, truthfully don't know. And I'm concerned about this based on what you've told me. I'm concerned about this limitation. I'm concerned about this outcome. So I can sort of re-echo the risk assessment or the concerns that I have about the case, or, again, whatever limitations are that they've already shared. I can echo that back. But the moment I find, and this comes back to that sort of boundary setting, the moment I kind of going, well, if I was in your position, that for me is the automatic red flag of going, no, you can't. That's not your perspective. There's no possible way you can reliably insert yourself, even with all the best intentions of empathy and sympathy and all of those sort of collaborative emotional strategies. It's ultimately their decision.
Yeah, great. Thank you. Honestly, that's so helpful. And where can people find out more about that, navigating difficult conversations? Is that on Mike's website? And I think I've got a link here, if I could just bring it up just to show everyone.
Yes, that's the one right there. Yes, that one's going to be there, and that I believe is available for after. So the live version is there, or is done already. But I do believe that the recording will be available for purchase afterwards. And if anybody's looking for any additional conversations as well around, navigating client communication or any of these other viewpoints on some of these strategies, I do try to keep the conversations like this one, for example, when this one is released, I will put a link to that on my website, drpachel.com. So if somebody says, oh, I really liked his particular, viewpoint on this, going to drpachel.com and then going to the media tab, then you can find podcasts, you can find articles, you can find videos of different conversations, again, like this one. Some are webinars for purchase. Other conversations like this are available for streaming, really just to continue those conversations forward into the community as best we can.
Fantastic. And all the links for this will be on the podcast too from my end. So if you're watching this back later, then all the links will be there. So you can find more about yourself, Chris, at your website, which is up on the screen just now, and that will be in the description. You can also find you at this one too, is that right? Animal Behavior Clinic. And that's the clinic you work in full time, is that right?
That is correct. Yep, that's the clinic that I own here in Portland, and that's where it's myself and 3 other veterinarians. One who is board certified, one who is a general practitioner with a practice limited to behavior, and then I have one of my residents works with me in the practice here as well. I've got a second resident who sees cases independently at his practice in Australia. But yes, Animal Behavior Clinic, that's where you can find more about sort of the professional services that we offer through the clinic.
Sure. And what have you got coming up in the pipeline? Any interesting seminars, conferences, anything coming up?
So we've got a couple of things. We'll be in Chicago next month. We're in September now. Yes, October next month for the Aggression in Dogs Conference. I'm really excited for that one. Mike Shikashio and I are giving a weekend seminar in the Denver area coming up in November. And then from there, I've got a couple of new webinars coming out through Dog iBox as well, on some new topics there. So again, I try to keep those as best I can, sort of the calendar up to date and announcing those on my social media channels as well. And so, if people are looking just to kind of stay in touch, by all means, follow me through Facebook or Instagram. If you want to connect with me, I encourage that as well. I do just request, send me a little bit of information about yourself as an introduction. I'd love to know who you are and where our paths crossed, and how I can be sort of of value and of service in that relationship.
Oh, fantastic. I wish I was more local to you, because I would definitely be there, but it's a little bit of a trip for me. Maybe Clicker Expo though in March. Are you speaking at
Yes.
this?
I am speaking at Clicker Expo in March in Washington, D.C.
Yeah.
And I think if everything goes according to plan, I think there's still a plan for the WOOF UK conference somewhere at the end of 2022.
Right.
That I was on the docket for that when it was the last iteration that was supposed to happen mid-pandemic. So fingers crossed, I may be coming across the pond to your neck of the woods as well.
Love it. Well, I'm definitely going to Clicker Expo, so I'll hopefully get to meet you in person there. And I appreciate we're coming up for an hour, and that probably brings us to a natural conclusion, Chris. I know you're a busy person, so I really appreciate you taking the time to do this. It's been fantastic talking to you. In the chat, I'm sure everybody will show you a lot of love, and I really appreciate it. So thank you very much for doing this, Chris.
Absolutely. Thanks for having me on. I appreciate it very much. All my best.
Thanks very much, Chris.